In our studio, Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital. Kind enough to join us on Wednesday mornings today in studio, which is always a good thing. Joe, you wanted to start out talking about Channing Frye a little bit this morning.
Yeah, I think there's a couple teaching points about Channing Frye. Everybody's talking about him. He's probably the hottest Cleveland athlete right now. You know, there are a lot of interviews and things. He's done so well and helped the team move forward. And, of course, this is a big week going into the playoffs, and we're pretty healthy, but Channing Frye had a year. He missed an entire year with a heart problem. We were talking last week about physical exams, and this is the great time to do your sports physical and get that evaluation done. And we talked a little about sometimes the thing we're looking for a needle in a haystack is a heart problem. And in Channing Frye's case, a few years ago, they picked up a heart problem for Channing Frye. And at the time of the physical, they did an echo and said he had an enlarged heart. And it's good to pick that up beforehand rather than later, because that's a life-threatening kind of problem. And so they picked it up. In Channing Frye's case, they worked it up then, did a stress test and some other cardiac tests, and they found out that he had a cardiomyopathy, a viral cardiomyopathy from a virus infection that he had. And with the viral infection, that's actually a good thing. It's a treatable thing. It gets better on its own. So some structural things, we have to tell kids you could never play sports again. But in this case, because the virus takes about 6 months to a year to allow the heart to recover, he sat out 1 full year. Thankfully for the Cavs, he came back, finished that the following season with Phoenix, went on to Orlando, now with the Cavs, and that's the rest of the story. But it's exactly what we're trying to do at the time of physicals. We're trying to find those kids who may have an enlarged heart or a heart problem. And one of the things, Ray, that I would talk about is a symptom that makes us work them up and do further, because as I told you last time, we don't do echoes and EKGs, heart tests on every athlete that gets a physical done. There's 30 million athletes, high school athletes in this country, is a thing called syncope. And syncope is passing out when you're playing sports. And definitely passing out when you're playing sports definitely requires a workup of more cardiac tests. And one really good program we have at Children's now that makes all of us sleep a little better, we have a syncope clinic. So rather than just saying, hey, I'm going to call in, hey, you got to see a cardiologist. Okay, well, we have an appointment in 3 weeks. Well, then you're worried about that whole 3 weeks. What's going on with this kid who passed out and everything else? Is that you call and they get you in within 24 to 48 hours to do that testing at Children's with a nurse practitioner working together with a cardiologist. So if anybody's having a passing out problem, or a doc or a trainer is seeing one of your kids with a passing out problem, know that now you can call Children's Hospital number and there is a syncope clinic to start that workup the next day.
With us in studio, Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital. You know, I coach a travel baseball team, 14U team, and one of our players was having, and probably there's a lot of coaches and parents that can relate a little bit, and that's why I'm bringing that up. He was complaining about a soreness on his shoulder after he would throw for about 5-10 minutes. And finally he said, hey, might want to go get this looked at. Well, he did yesterday. And it came back, and you said it was
scapular dysfunction.
Yes.
Yeah.
Explain what that is, because to me it's a sore arm, but I don't know any further. I know you don't know the exact case.
Yeah.
What is that?
But it's a term we use a lot, and it's a term like so many other things in medicine. We use it a lot because it makes us sound smart, doesn't it? Oh my gosh! If the doctor and trainer know the name scapular dysfunction, no, you know we have our own vernacular, our own terms we use in sports medicine, and what my job is to try to break down for the kid what in the world is scapular dysfunction. It's kind of like shin splints. It's just a general term when kids are throwing a lot. But the bone in the back of the shoulder, the flat bone, the shoulder blade, has 8 different muscles that attach to it. And when these muscles are not working together, you can watch these kids from behind when they throw or do overhead activities, and what you'll see is that scapula is not moving smoothly. It's rubbing against the rib cage. It's moving abnormally. Typically, if you'll watch somebody lift their arms from behind, you see a nice smooth movement of that scapula bone over the rib cage. And if it's not moving normally, it means those muscles are out of balance. And a name for out of balance or not working well is dysfunction. So an initial thing to do is try to get them working together through some physical therapy and relative rest. So you told me a very smart thing to do. What do you do when you're throwing hard? When you're pitching, every pitch is a maximum effort throw. When you're playing second base or first base, those are the two positions on the diamond with the least maximum effort throws. As you well know, most second base throws are you don't have to throw as hard as you do at first base, not as many throws. So often we'll move a kid to a DH position for a few weeks perhaps, and then we'll play him at second base or first base if those positions are available on the baseball team. We have to leave the decision making to smart managers like you, but that is, so we'll move them, we'll relatively rest them, we'll get those muscles working together, and in 6 weeks 80 to 90% of kids are throwing well again without pain. Now what about the other 10 or 15%? They may have something structural like a labral tear. So then maybe if they're continuing to have pain and it's going into a month, 2 months, 3 months, sometimes we have to do further studies to look at other structures inside the shoulder.
Is this something that's somewhat common with teen boys or girls that are throwing overhand, whether it be throwing or tennis or something that's going with that overhand motion?
Exactly. The overhead motion of tennis serve, volleyball, swimmers. It's very, very common in swimmers. This is the most common overhead shoulder problem that we see is a pinching syndrome or a scapular dysfunction, a muscular problem, an imbalance, an overthrowing. And when we relatively rest them and rehabilitate them appropriately, most get better, luckily, in younger athletes. The more they continue this abnormal motion, the more chance they may tear something like, in younger throwers, the labrum, in older throwers, the rotator cuff.
All right, good stuff. Thanks for coming in.
Thanks, Ray. Love it.
Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital, with us live in studio.